name is Nico Gagelmann from the University Medical Center Hamburg-Eppendorf in Hamburg, Germany. And it's a real pleasure to present our results on the role of driver mutation clearance after stem cell transplantation for patients with myelofibrosis. One thing that is really important to understand for myelofibrosis patients is that myelofibrosis is a disease where we actually have 3 driver mutations, JAK2, CALR and MPL, that we can measure after stem cell transplantation with quantitative or qualitative PCRs. And one thing that we saw over the last 15 years in transplantation is that there are different dynamics of mutation clearance after stem cell transplantation. We now know for several years now to better select patients before stem cell transplantation, but what happens after stem cell transplantation for now was really not well known. And what we do for the last 15 years is we really prospectively evaluate the driver mutation clearance after stem cell transplantation over a period of 1 year after transplant. And what we found for the first time was, first, that at day 30 or day 100, if patients completely cleared the driver mutation, the outcome was very, very, very good, with a very low risk for relapse. The other thing was, which is much more important, is that previously CALR and MPL mutations that were associated with better outcome, that those clearly, significantly and much more early cleared the mutation. So this is one biological feature that helps us to understand why these patients have better outcomes after transplantation, because they clear the mutation much earlier. And the other thing is that helps to identify patients is that patients with CALR, which have a much better outcome onset before transplantation, when they are positive at day 30 or day 100 after transplantation, they have worse outcomes than patients who are negative. So mutation clearance at day 30 and at day 100 is really, really important to understand the prognosis of patients after transplantation, even for patients which might have had onset better prognosis before transplantation. And because we do that prospectively for the last 15 years, and we have the biggest cohort so far, the best experience in myelofibrosis, this should be actually the standard of care for all centers across the world to do mutation clearance measurement after stem cell transplantation.